People, hold on to your hats. We're going to make your day happier with some amazing news that we have to share. Millions of Americans are beginning to feel a surge of comfort and support as a result of Senator Sanders' measure, which went into effect in April. A welcome surprise awaits recipients of Social Security, SSI, SSDI, and VA benefits. An additional $1,900 will be added to their monthly payouts. Just consider what that would entail for you and your family. Some extra breathing room, an opportunity to pay bills on time, or perhaps even a small pleasure for yourself. But there's still more. We're delving deeply into the specifics of this revolutionary law in this video. We'll simplify it so that everyone knows how it operates and what that means for their financial situation. Do you need Social Security to make ends meet since you are retired? Do you receive benefits from SSDI or SSI as a result of your disability? Or maybe you're a veteran living off of VA benefits. This video is for you no matter what. We're here to explain the significance of Senator Sanders' measure and how it will affect your daily life. At the bill signing ceremony, President Biden said, "Too many Americans have been struggling, especially our seniors, those with disabilities, and the heroes who served our nation in uniform. This administration and this Congress are taking action to ensure none of our most vulnerable citizens are left behind as we work to get inflation under control." The $1,900 installments will start to arrive in a few weeks, according to the Social Security Administration, with the first direct deposits showing up in bank accounts on April 20th, 2024. Starting on that same date, the mailing process for people getting physical checks will take several weeks. Additionally, the IRS has certified that these extra payments are not taxable income for the 2024 tax year. This means you can spend all $1,900 of it without worrying about incurring debt when it comes time to file taxes the following year. A few essential conditions must be met in order for you to be eligible for the maximum $1,900 payout. You will be eligible for the entire $1,900 payment if, as of December 31st, 2023, you were receiving SSDI payments or Social Security retirement benefits. As long as they are still actively receiving payments as of March 2024 and have been an active beneficiary for at least 1 month in 2023, anyone receiving Supplemental Security Income, SSI benefits, will be eligible for the $1,900 payout. Veterans Affairs beneficiaries are eligible for the $1,900 if, as of December 31st, 2023, they were receiving disability benefits, pension payments, or dependency and indemnity compensation, DIC. More than 60 million Americans who receive VA, SSI, SSDI, or Social Security benefits are predicted to be qualified for the $1,900 payouts. The Act outlines certain exceptions and exceptional situation criteria, just like it does for most government programs. A maximum of $1,900 payment should be given to beneficiaries who received benefits from more than one program, Social Security plus SSDI, for example. Only dependent children and spouses whose benefits are based on the record of another recipient will be eligible for the $1,900 payment indirectly through that primary beneficiary. Those who were initially refused benefits in 2023, but who, by March 1st, 2024, had their denial overturned on appeal, are still eligible to receive the $1,900 payout. Instead of actual checks, Direct Express debit card customers will have their payments deposited into their current cards. Advocates for people with disabilities and those fighting poverty are praising the new bill as a long overdue step toward helping society's most vulnerable members. In 2023, 37% of senior Social Security beneficiaries were expected to rely on their benefits for at least 90% of their entire income. Of these, 25% of elderly married couples and 40% of elderly single recipients lived in poverty. A stunning 26% of Americans with disabilities were living below the poverty level in 2023, according to data released by the U.S. Census Bureau. According to Joanne Jenkins, CEO of the group AARP, This $1,900 payment is a lifeline for millions of seniors just to keep up with basics like rent, groceries, and medications. While it's not a permanent fix, it will make an enormous difference in the short term as we continue pushing for reforms to better support older Americans trying to survive on meager fixed incomes. Given that the average monthly Social Security retirement payment was barely $1,551 as of March 2024, according to the SSA, the additional financial help is extremely important. That only puts an aged single person at 138% of the federal poverty line before the extra $1,900 payout is taken into account. Leaders of the ARC, one of the biggest national groups that supports individuals with intellectual and developmental disabilities, IDD, shared similar feelings of relief. According to Peter Burns, CEO of the ARC, the last few years have been absolutely brutal for people with disabilities who were already struggling to make ends meet. The $1,900 payments will provide a significant boost at a time when basic costs have skyrocketed out of reach for millions living on meager SSI and SSDI benefits. The maximum monthly federal SSI benefit as of January 2024 was only $914 for an individual, or 79% of the federal poverty threshold. A disabled individual who is heavily dependent on SSI will have an annual income of only around $12,800, barely making it above the poverty line, even with the addition of the $1,900 payment. The effects on the disabled people in America extend beyond merely monetary difficulties. In 2023, the U.S. Commission on Civil Rights conducted an investigative study which revealed that approximately 38% of households with a disability member were facing food poverty, and 30% were facing difficulties in finding affordable housing. Another pervasive problem was access to quality healthcare and services for people with disabilities. Veterans advocacy groups such as AMVETS applauded the bill's inclusion of VA beneficiaries, guaranteeing assistance for low-income and handicapped veterans receiving pension payments. The federal government came under fire from watchdog groups for permitting hundreds of thousands of veterans to become impoverished because they were unable to support themselves solely on their VA benefits. Greg Ewan, national commander of AMVETS, stated, "No American veteran should be struggling in poverty after serving and sacrificing for our nation." While just a temporary payment, this is a step in the right direction and an acknowledgement that the current compensation levels for disabled vets are woefully inadequate, he stated. The maximum monthly VA disability benefit for a single veteran was $3,759 as of December 31st, 2023. That came to a mere $4,644 for a veteran who also had a spouse and child. Many disabled veterans and their families found it difficult to make ends meet as the cost of housing, healthcare, and childcare increased. Despite being extremely well-liked by advocates, veterans, the disabled community, and elderly, the $1,900 payment plan wasn't without controversy on Capitol Hill. Politicians argued vehemently about the estimated $100 billion price tag and their worries about adding to the already massive federal deficit. House Floor Leader Mike Bost, RIL, questioned, "At what point do we finally get serious about our unsustainable deficit spending?" During the debate, "We're addicted to smashing through the debt ceiling to pay for countless billions in reckless new spending." Defenders of the he, along with President Biden, contended that our sacred duty to care for the most vulnerable members of society should take precedence over fiscal responsibility. President Biden said during the bill signing ceremony, "Look, I respect concerns over federal spending, I really do. But I bluntly refuse to allow bean counters on either side of the aisle to nickel and dime our veterans, elderly citizens surviving on meager fixed incomes, and our disabled community being crushed by rising costs." The $1,900 payments, according to the impartial Congressional Budget Office, would increase the national deficit by around $100 billion by 2024. The CBO did point out that the impact of the deficit will be somewhat mitigated by higher consumer spending and economic growth brought on by directly giving billions to more than 60 million Americans who are struggling financially. Even though the direct $1,900 payments offer much-needed temporary respite, policymakers and advocacy organizations are already focusing on more significant, long-term fixes. Leaders of the House and Senate have resumed high-stakes talks for budget measures that, for the first time since 2019, ask for raising Social Security and SSI benefits. Major disagreements still exist, though, on how to pay for such broad increases without causing the deficit to continue skyrocketing. During his campaign trail, President Biden advocated for raising Social Security benefits through the implementation of cost-of-living adjustments, COLAs, that are indexed to the annual rate of inflation. In addition, his budget proposal would increase the minimum monthly SSI benefit to $3,590, the federal poverty threshold, for an individual in 2024. Significant changes to the VA disability compensation program are being suggested for veterans. They include revised medical standards for determining disability ratings and possible adjustments to payment schedules. According to one proposal supported by the Disabled American Veterans Association, Virginia disability compensation rates should be immediately increased across the board. Increases would range from 10% for individuals with lesser disability ratings to 25% for those who are classified 100% permanently and totally disabled.